Hi everyone, I'm Dan Henschel. I'm a psychotherapist, and in this video I want to talk about some of the most cringe things that patients will say to me in therapy. So things that patients say that just sort of make me go like, or get secondhand embarrassment, basically. So one of the big ones that I've started to get a lot in the past couple of years for some reason is people who come in and they say something like, well, I want to die, but I don't want to kill myself. I just want something to happen to me. I want to get hit by a car, but I don't want to actually do anything to myself. And I'm like, okay, you're so edgy, right? You're so cool. As if I haven't heard that exact same sentiment 10 times in the past week. And everybody who says it thinks that they're the first person ever come up with it and that it's such a unique thought to have. And I think a lot of that comes from the fact that people have started to realize that if they actually say that they actively want to blank themselves, then it becomes a whole situation. But so, you can say that. It's just, I don't know. Don't act like you're the first person to ever think of it. You're not Hunter S. Thompson. Another thing that really bothers me is when people come in and they start, I'll ask them what their problem is, and then it's clear that they just Googled the diagnostic symptoms of a mental illness and decided that they have it already. So they come in and they start, basically listing those symptoms word for word as if they just happen to be what they're feeling all the time. So I'll say, what's wrong with you? And they'll say, well, I feel like sometimes I alternate between idealization and devaluation, or, well, a lot of times I feel like I avoid, I take frantic efforts to avoid real or perceived abandonment, and I'm like, oh, how convenient, So, I don't know, just say how you're actually feeling. Don't try to get me to diagnose you with something that you want to have and that you think you have, just because you read about it. I'm not stupid. Right? This is my job. I know when you're saying things that are just in a book. Another big one is when people come in and they clearly they want a very specific medication like a Xanax or an Adderall or something. But they don't want to come right out and say it. They'll say like, well, I have a really hard time focusing throughout the day, and I wish that there was a way that I could just easily and quickly focus on things and get them done, or like I have panic attacks and I get really nervous and it's very hard for me to calm myself down, wink, and ironically, this is what shows me that they really, really want the pills, right? Because if somebody just comes in and they say, I want Vyvanse, or I want Xanax, can you give that to me? Then I know that they're not going to abuse it, and I know that they're not looking for it in an unsavory way because they don't know that they should be worried about that. In other words, they're coming right out and saying it because they're not aware that there's a stigma surrounding it, and they're not aware that it can be abused. Somebody who knows it can be abused and somebody who really wants it because they think it's going to be fun doesn't want me to pick up on that, right? So they disguise it and they conceal it because they know, and I know, that it's something that they shouldn't, that if I think that, it's going to be bad. So they're concealing that information. And the last one, I guess, isn't really a specific thing. It's just this whole attitude where people come in and they're, they're brooding and they're closed off and they're kind of indignant about having to go to therapy at all. They think, well, this isn't going to work. This guy's not going to help me at all. And then they act like I'm supposed to be so interested in decoding their mysterious personality, and I'm supposed to be like, ooh, what are your mysterious problems? Sweetie, I guarantee you that the worst thing you could possibly say to me, I've already heard 5 times this morning from somebody who looks and acts exactly like you and has the exact same jacket, So, again, you're not as unique as you think you are. You're not as special and mysterious and cool as you think you are. Just be normal. and get over yourself. And then maybe we can actually do some constructive work in session. So, there's probably more, but those are the biggest ones that I've noticed recently. And again, I'm not trying to put people down for doing this, because I know therapy, you're supposed to be kind of vulnerable, but it's just when I can tell somebody's putting it on, or I can tell somebody's trying too hard, it's annoying, and like anybody would be annoyed by that. And you don't want to annoy me as your therapist, because if I think you're annoying, then I'm not going to want to help you, and I'm going to be just sort of like judging you all the time. So, yeah, I guess that's it. Okay. And remember, if you want help, then please seek out help. Just know some of these things before you go into it.